Someone asked me if I could do a video on the emasculation of the white male and the empowerment of the black male recently, but I want to try and steer away from race because I've recently had two videos removed for racially charged content of some sort. I'm not exactly how, because I'm pretty mellow with that sort of thing. But let me go further. Okay, I'm going to talk about how me, and I don't consider myself an emasculated person, but how our society promotes neurosis in many ways. This is going to go into a thing on medication. The epidemic of mental health concerns, don't get me wrong, the symptoms are very real. The anxiety, the anger issues, all these things are very real. But they're fostered by a society that promotes mental illness. They promote, one, acceptance of poor behavior, and also the exasperation of certain behavioral aspects. The sociopathic personality type is championed as a success. That's the guy you want to be, as the sociopath. Okay, the guy that uses people to get what he wants. Okay. Now, many people are not sociopathic, but you are pressured to behave in such a way. The other issue is, for example, like me, I would not consider myself a feminine dude. But what I would say is, in order to get by, I have learned to act in a far less aggressive manner than I originally did. Prior to having to get by in office settings and things of that nature. You need to learn how to behave in a more mellow sort of way to get what you need, which is usually a paycheck. Okay? Unfortunately, when that trickles into regular life, it can be quite disempowering, I will just say. In fact, it has recently caused a lot of troubles for me. But how does this carry over to psychiatric medication? Well, there was another dude that asked me if the psychiatric medications that these mass shooters take, if that plays a role in their, in these mass shootings. I would most definitely say absolutely yes, because every one of these mass shooters has been on psychiatric medication or just coming off of psychiatric medication. So what you see here is this, and this is why I tell people, read your package insert on your medications. When I worked in mental health, I used to pull up drugs.com and FDA.gov and all this nonsense for my clients that were receiving psychiatric care in the same clinic. Why did I do this? Because the psychiatrist, even if the psychiatrist wanted to, and some of them do. I know one guy, a really good dude, he really does want the patients to be safe. But the problem is, if you ever look at that package insert, you need a friggin' chemistry degree to understand it, and it would take 17 years to get through the thing. So it's very difficult to actually give the patient proper knowledge of the medications. But a lot of these medications, the antipsychotics and the antidepressants, will make you suicidal and homicidal. And that's known. That's been known for quite some time. A lot of people will diss me. A lot of my coworkers when I worked in mental health would go, well, why don't you receive mental health treatment? You need therapy. You need this. You need that. And the reason why is because I can see what it does to people. It really does make people worse. And when you have medications with warnings that it will cause a depressed person to commit suicide and a psychotic person to go on a killing spree, and all these other things, you might want to think twice prior to taking these medications or receiving these treatments that are not proven to actually be beneficial. It's very difficult to prove a benefit for psychiatric or behavioral health practices. That being said, we have a culture, our culture, the American culture, and the Western culture in general, that has promoted an emasculation of the of men, generally speaking, not just white men, all men. So what happens is, in order to get by, we've had to become less forceful, which is terrible because it most recently, I should have been very direct with a person, and I did lose them from my life forever because I was not direct enough. And unfortunately, that person did not know my intentions, and unfortunately, that person was harmed because of my indirect attitudes and my emasculine or my effeminate behavior, I should say. Not overtly effeminate. I'm not one of these guys with frosted tips or something. But it was feminine enough that it was not the usual me, the old-fashioned me. Unfortunately, with the society we're in, the old-fashioned me would have been thrown in prison and never let out because we live in a society that does not appreciate or support masculine behavior, direct behavior, heroic behavior. And what happens is when you try and push that aggression, that natural, healthy aggression, into a little place and forget about it, it does become a problem. And this is the thing. We have a society and a mental health industry that is ignoring natural things that we know about the differences between men and women. You have a mental health industry that is trying to promote LGBTQIAP culture and stating that there aren't any differences between chromosomal men and chromosomal women and that you can choose your gender. You have a behavioral health system that is basically a sort of a direct propaganda wing of leftism, but this is by accident, and this is because behavioral health attracts leftists. Now, what has happened is because these people have gained respectability by the legitimate medical community, they, the behavioral health people, are given the same authority as real physicians. Real physicians. And don't tell me that psychiatrists are real physicians. They are not. They are physicians that are afraid of blood, so they took up philosophy. That's my opinion. And I do want to make sure that everybody knows, please watch this video all the way through so that you hear my disclaimer. I am not a doctor. I am not a therapist, and I should not be giving medical advice. However, use your common sense. I would encourage everybody to buy a psychology textbook and read it. And actually read it. Read how crazy these ideas are. And ask yourself, where's the objective facts? Where is the real research proving the non-biomedical aspects of psychology? There aren't any. And when they say that there's a biochemical imbalance, that's never been proven. And that's why I do encourage everybody to go to cchr.org and cchrint.org, fda.gov, and actually look into these dangerous drugs that are being prescribed to everybody like they're frickin' Tic Tacs. And that's the thing is, these drugs are very powerful and alter the mind and cause severe health conditions of the liver, the kidneys, the brain, and convulsions, all sorts of deaths, organ failure. And nobody cares. And they're being prescribed like they're actual medicine, like they're actually treating a real condition. But these conditions have not been proven to even exist.